Hi, I'm Molly, and I'm coming to you from Aquacare Rehab in Millsboro, Delaware. Today I'm going to talk a little bit about benign paroxysmal positional vertigo, or BPPV, since that's a tongueful. BPPV is a type of vertigo that is very common in the aging population. Statistics say that about over the age of 70, about 50% of the population will experience this type of disorder. And what it is it's an acute onset of vertigo that happens with a change of head position. How this actually happens is that in our inner ear we have these little systems that make up our vestibular system. These little systems act like little tiny gyroscopes in our ear. They tell us what position our head is in, it responds to gravity, and it responds to acceleration. So this is really important when it comes to balance, your overall orientation. What can happen in BPPV is that there's a portion of this system that has little calcium bicarbonate crystals, and they basically sit together in a clump on top of a bunch of hair cells. This is important because your body needs those little crystals to be able to detect gravity. So as you turn your head, those little crystals weight down the hair cells, and they cause that hair cell to bend, which sends a stimulus to your brain to tell you where you're at in space. What can happen over time, though, the fibers that hold those crystals together can weaken, and one or a bunch of them can kind of fall off of where they're supposed to, and then they get lost into kind of a maze of the inner ear. When this happens, they basically get trapped into these circular loops where they shouldn't be, and they create a sense of movement every time they move, and it's created on one side of the head while the other side has no altered sensation. When that happens, it creates kind of a dichotomy in your brain. One side's getting sensation, one side's not, so it creates a spinning sensation. When you're having this disorder, pretty much every time you move your head into a provoking position, you get a strong, intense wave of vertigo lasting about 1 to 2 minutes. If you don't move, it subsides. But then when you start to go into that same provoking position again, the symptoms return. The most kind of provoking positions are lying and rolling into bed. So usually the side that you're having the pathology on, when you lie onto that side or roll onto that side, again, you get that strong wave of vertigo, maybe even some sweating and some vomiting. Usually once you're there and you're settled, the symptoms will resolve within 1 to 2 minutes, you feel fine, and then again, maybe when you're getting back up, they come on again. Another kind of provoking symptom is looking up into the air or bending forward to pick up something off the ground. Other movements can provoke these symptoms, but those are just some of the most common. When this comes on, usually it lasts a couple weeks to a couple months. Sometimes it will spontaneously self-correct, but it can be very debilitating when you have it. It kind of limits your ability to go through your activities, to get a good night's sleep. It feels really, really disorienting when you do have it. The good news is that that's really, really easy to treat. Basically, you can see your local physician. Sometimes they'll even do an in-house treatment there. But if it's not something that they're familiar with or comfortable with, you can come see me. Usually it's a series of 1 to 3 visits. When you come in, we check to make sure that you have it, and then we take you through the correction. The correction takes about 15-20 minutes to go through, and basically we take your body and we put it into a series of different positions that allow us to slowly move those crystals back into a space that's large enough for them to dissolve. When this happens, usually we can get it done within, like I said, 1 to 3 visits, really easy to treat, and at that point you're feeling great, no difficulty rolling in bed, no problems looking up, looking down. So if this is something that you think you have, definitely give us a call here at the office, or stop by for a free screening. Definitely something to look into, something to talk with your doctor about, something that you don't have to live with. Thank you for your time today.